Hi, my name is Anthony, and this video presentation is for pathophysiology. This is in regards to family education. So I chose to educate Mr. Smith and Mrs. Smith in regards to stroke care and prevention. Hi, Mr. Smith. My name is Anthony, and I will be your nurse for today. I would like to ask for your permission, if I may, include Mrs. Smith and in this education. I would like to educate both of you in regards to stroke care prevention. As you probably already know, Mrs. Smith, as you know, has just had a stroke. Unfortunately, patients who has just had a stroke are at a high risk for developing another stroke. Also, considering that he also has a history of atrial fibrillation, that also puts him at another risk for stroke. So, I did create this pamphlet. It's on stroke care and prevention. So if we open up the pamphlet, the first thing that you'll see is the acronym FAST, which is F for face. So a facial droop or weakness on the face is one sign of a stroke. And A is for arm, weakness in the arm or limb. And S is for speech. So slurred speech, garbled speech is another sign of stroke. And T is for time. Time is essential. Time is brain. So as soon as you detect any signs and symptoms of stroke, it's important that you call 911. Other signs and symptoms that are not included in the acronym is confusion, severe headache, and also any weakness on any arm, limb, including the leg, and also dizziness is also one other potential sign of stroke. All right, so moving forward, inside the pamphlet on the right-hand side describes the two main types of stroke, which include ischemic stroke and hemorrhagic stroke. So an ischemic stroke, which Mr. Smith had just had, is caused by a clot in the brain. And so that happens when a clot impedes or stops blood flow to the brain tissue and causes tissue death in the brain cells. So the other type of stroke is hemorrhagic stroke, which is caused by brain bleed. And the most common cause is high blood pressure. So that's why I did list the risk factors also on the right side here, which include hypertension, atrial fibrillation, diabetes, smoking, alcohol consumption, and also unhealthy diet and lack of physical activity. And then in the middle part of the pamphlet includes information about hypertension. So the normal blood pressure is below 120 over 80. So the top number is the systolic pressure below 120, and then the diastolic, which is the lower number below 80. So it's important that you monitor blood pressure to be treated to prevent a stroke. And then also, as you go down the list here, it lists the other risk factors that could be modified to prevent future strokes or potential strokes, which include stop smoking, stop drinking alcohol, and also controlling blood pressure, also taking anticoagulants for the atrial fibrillation, and a healthy diet. So there is a diet that's called DASH diet. So dietary approach to stop hypertension. So it's basically diet that is rich in fruits and vegetables, low in fat, and low in salt, and low in sugar. So it's important that Mr. Smith also have or is able to do some form of activity or regular exercise that is that he can tolerate as he recovers from a stroke. And then on the far right side, left-hand side right here is information about support system following up after stroke, which is very important. So it's important that he follows up with his physical therapist, occupational therapist, and speech therapist for him to recover and hopefully regain his health as he was before the stroke. So it's important that follow-up care is important, and also managing his atrial fibrillation, continuing with his medication, maintenance medication for his hypertension, and also eating a balanced diet, etc. And then also following with his primary doctor and his vascular stroke doctor. So if you guys have any questions, please feel free to let me know. I am here to help guide you during his recovery. And thank you again for your time, for allowing me to provide this education to you both.